There's some very common questions that we get during our consultation when patients are researching for full arch reconstruction. One question is, how is it possible to remove teeth and place implants and non-removable teeth all in one visit? Many of our patients either know somebody or maybe even had an implant that was placed previously for just a single tooth, and it took many, many months, anywhere from 3 to 12 months, to get the final crown for that tooth. When we do a full arch of implant, we are able to not just place the implant in a specific spot, but we can pick and choose where your best available bone is. We can determine the best bone by using advanced technology. We have 3D digital x-rays and digital impressions, and we can merge that together on a 3D software or virtual planning software. After the implants are placed and we place a full arch of teeth, it's much like a cast on a broken leg. You're splinting all the implants so the forces are distributed instead of overloading one implant. And this is why the teeth can be placed in one visit in one day rather than waiting months and months and months for the implant to fuse to the bone. Another question patients often ask, if I have missing bone or gum disease, how is it possible to place implants and the teeth all at one time without first taking care of that? Well, one reason is we're eliminating the cause of the disease, which is decay and gum disease. When you remove the teeth, you remove the disease. Patients wearing dentures don't have gum disease. A very common question about this procedure is what to expect for pain afterward. And of course, if you're removing teeth and placing dental implants, there's going to be some pain, there's going to be some discomfort. But most of our patients are extremely thrilled and surprised at how little pain that there is. I think one of the reasons for this is because, unlike a denture or partial, the teeth are not sitting on the gum, but rather they actually sit on the implant, which is supported by the bone. And so you don't have that compression of the tissue, so we don't see near as much pain with this procedure. While these are some of the most common questions, the best way to find out the answers to your question is to give us a call or go to our website, make an appointment. We're here to answer any questions you may have.